So here's a little summary of the sort of things I've been seeing today in clinic. My first patient is a woman I've been working with for almost a year now. She'd been seeing someone else for her hormones, and the balance wasn't quite right and she wasn't feeling good. So we've been doing lots of different testing. She's really sort of into, looking after her health in the full. So we've been looking at methylation, gut health testing, managing her stress. We talk about what's going on in her life because the stress and emotional component has a huge impact on what's going on with her hormones. And slowly, through really starting off low with the hormones, we managed to titrate up really slowly and get her to a place where she's feeling pretty good at the moment. So that's always nice to see. But kudos to her, the commitment's on her. She's really, really committed. She travels from quite far to come and see me. So yeah, she's like super committed to her health. The next lady I saw, we've been working on her insulin resistance and weight loss, and she's starting to see some results. So that's really good. We've also been working on her hormones and her DHEA because she was exhausted all the time, and now she's got sustained energy throughout the day. So that's really exciting as well. The next lady was kind of her 6-month checkup. She had her bloods done. We talked about optimizing her levels. She feels pretty good, but her levels were pretty low on the blood. So I'm not sure if she's getting the physiological benefits for her heart health and her bones and her neurological health. So we're going to slowly titrate up, see how she feels with that. Obviously, listening to her body, if it feels like too much in terms of things like breast tenderness or just not feeling good in herself, we can stick to what we were doing. But I wanted to get the full benefit of the hormones she's taking. The next lady was a lady I haven't seen for a couple of years. We've done some routine bloods. We're optimizing her hormones again. And also talking about longevity. So we're working on her gut health because she gets bloating and her bowels aren't open that often. And also looking at her vitamin and mineral analysis. And then I'll review those results in a few months' time. The lady I saw after that, we're really working on bringing her cycle back. She's quite young and her periods have stopped. I think it's due to methylation and stress. And we're also looking at ways of increasing her healthy fats in her diet, as all the hormones are made from fat, basically. So we're working on that and seeing if we can help her with her goals of getting her cycle back. The lady after that is a woman who I've been seeing for many, many years. She's had endometriosis. We have to use quite low levels of hormones for her HRT because we don't want to stimulate anything. And we just kind of did an annual review of the bloods. I've also talked to a couple of women today about their high cholesterols and looking at supplements like red rice yeast, seeing where it could be dietary. Maybe looking at something like a calcium score, which you need a referral to a cardiologist for. In the olden days, you had to have a calcium score you can have a calcium score, you'd have to have an angiogram that looks at your heart and the small vessels around your heart. But now you can basically have a form of CT scan to check how furred your arteries are. And that's going to really inform you of whether this high cholesterol is a risk or if it's just maybe a genetic thing that's not really an issue for you. So that's been my morning in clinic. It's been quite varied and quite interesting and gives you a bit of an insight into my approach with my patients and the sort of things I do in clinic.